Welcome back. Well, more concerns about how the disease Mpox is spreading through parts of our continent. Since the start of the year, over 400 people have died from Mpox in Africa. Meanwhile, a new form of the virus has emerged in the DRC. The disease is spread through very close personal contact. Dr. Jean Kaseya is the Director General of the Africa Centers for Disease Control. Dr. Kaseya, good evening to you. It seems this virus is almost moving quite quickly. I mean, I realize it's a slow-moving virus, but what seems to be driving this outbreak?
I really don't know if I can say that it's moving slowly. The first case of Mpox was notified in 1970 in DRC. You see, it's almost 54 years that we started to talk about Mpox. But yes, it was in 2022 that we got around 40 strains of Mpox, and that led for Africa, for WHO to declare the public health emergency of international concern, because we saw around 117 countries in the world affected by Mpox. It means it's there, but now what we see, it's becoming worrying for the continent and also for the world, with this mutation that we saw in DRC, where Mpox becomes sexually transmitted disease affecting mostly young people.
This new variant of it, this new type of the virus, how serious is that? Does that help the disease to travel more quickly, to be more transmissible?
Yeah, it's serious because it's killing people. And if you see data that we have, like in 2023, we had in Africa 7 countries affected, and around 1,600 cases with 738 deaths. And to date, we have around 500 deaths from the 1st of January to 26th of June. And now we have South Africa affected, and it becomes a serious issue.
Governments are beginning to react to this. Are they doing enough to stop it at this moment?
Let me confirm that the government of South Africa is reacting and is taking appropriate measures. Let me disclose to you and people who are watching us that myself, I had to discuss that with President Ramaphosa, even the day of his election. You see, while he could think about election, he was thinking about public health. This is what is giving me a clear message that at the highest level of the country, they are concerned about it. I was also talking with the minister, with Dr. Buthelezi. Even today, I received an official letter from Dr. Buthelezi. It means we are working with SAPA, the South African Public Health, Regulatory Authority. We are working with a number of government entities. They are taking the right actions against Mpox in South Africa.
I'm glad to hear that. Doctor, I've been told that one of the reasons that this disease may be moving across Africa now is that it's related to the disease smallpox, and smallpox vaccinations give some protection to Mpox. In Southern Africa, we stopped smallpox vaccinations about 40 years ago. Could that be one of the reasons, or is that for you not really the reason? I understand that the smallpox vaccination does give some protection to Mpox, but not a lot.
Yes, I can confirm that. We organized 3 months ago a regional meeting in DRC because 97% of Mpox cases are coming from DRC. But this meeting had to bring together 7 countries and around 200 experts from Africa and the world. Then during this meeting, it became clear to all of us that people were vaccinated who got the smallpox vaccine were protected against Mpox. And because we stopped that vaccination, as you said in South Africa 40 years ago, it means immunity started to decrease. And if you see, mostly people who are affected in South Africa are people who, if you see the trench is between 23 years old to 43 years old, are mostly people who didn't get this vaccination. I think now we are thinking, we know from science there is a clear correlation between a vaccine that we got 40 years ago and Mpox, protection against Mpox today.
It's also a lesson in the power of vaccines, isn't it? Dr. Jean Kaseya, really appreciate the time, sir. Thank you.